In January 2020, cases of the novel coronavirus started to emerge from and spread in Wuhan province of China. The rate at which it was spreading became a major concern for the people in the province and internationally. By March 2020, the coronavirus had been officially flagged as a pandemic, which led to a worldwide shutdown. However, due to socio-political and economical differences of each country, the response towards the pandemic was very different from each other, which further resulted in varying outcomes. Our research project makes an attempt to conduct a meta-analysis on between the approach of different countries in an effort to shortlist the best disaster management policies and measures from each country, which can be implemented in the event of a similar worldwide crisis in the future. To better understand the research, we will be presenting four countries: the USA, Armenia, China, and South Korea, and the effectiveness of their response. This will be our preliminary research to confirm the hypothesis.
We start with the United States and their timeline of regulations. In the first 3 months, the USA was dedicated to locking down the country and avoid getting cases from the outside. On Feb 3, 2020, the federal government declared the COVID-19 pandemic as a public health emergency. And by March 13, there were travel bans enacted to Europe and China, and the testing for hydroxychloroquine started in the US. Also, by the end of this month, the states enacted stay at home orders and the rest followed suit. However, by April, there was a gating criteria, which were a set of rules by the White House in order for state governments to follow while reopening their countries. Also, a saliva based diagnostic test was allowed for at home use so that patients could get tested quickly. However, by June 4, Lancet and NEJM retracted the studies on hydroxychloroquine and its use was rejected for COVID-19 pandemic. Also, around the same time, there was the highest stringency rate of 72.69 in the US, and the US COVID cases reached at about 2 million as states started easing out on the social distancing restrictions. By June 26, the White House commissioned a coronavirus task force, which was tasked to address the rising cases in the South. Also, by July 2 and by July 6, the scientists cited that the coronavirus could be transmitted through air, and states started reversing their reopening guidelines. By August 13, Biden called for a 3 month mask mandate, and the Trump administration released vaccination plans. Also, by November 19, Biden announced a COVID-19 transition team, and Pfizer published the vaccine results, which resulted in a 95% elimination. By Jan 2021, Biden laid out a 7 point plan as well as commissioned a COVID 19 task force. Here, we see two different graphs: the daily new confirmed COVID 19 cases and the stringency index in the US. The stringency index is the ratio between rules enacted in one country with respect to the others in an effort to see the strictness of said country's rules. Here, we see that between March and April, there has been a huge rise in the daily new confirmed cases. Around the same time, the stringency of the US was pretty much around the same. It was mostly on the low end. By the time the US had the highest stringency index of 72.69, the damage had already been done. As we can see marked on the right hand graph, it was around June 6, 2020. Even the stringency index of 72.69 was much lower than other countries, as we'll see in the next slide. As we can see here, the stringency index of USA was lower than Armenia and South Korea. The USA was heavily criticized for a delayed COVID response and even then easing out on a lot of the restrictions. The policies introduced by the Trump administration were executed lightly, and as seen from the graphs above, they were introduced way after the initial damage was done. The USA also received a very low score of 17.3 by the Lowy Institute, and even today we see around 250,000 daily cases. There have been a total of 29.1 million cumulative COVID cases, and moving forward, the Biden administration has provided $250 million to COVID relief and a 7 point plan moving forward.
The country of Armenia is governed by a parliamentary system. Prior to COVID-19, Armenia had a population of 2.598 million citizens and a population density of 104 people per square kilometer or 270 people per square mile. Armenia's GDP per capita was 13.67 billion US dollars in 2019. The response to COVID-19 was in par with most other countries. In 2020, their GDP per capita had dropped down to $9.8 billion US dollars. By March 5th, 2021, Armenia had in total 173,749 confirmed cases, 164,463 confirmed recoveries, 3,215 confirmed deaths, and a 7-day average of 320 new cases. Armenia received a stringency index of 88.9. Here you can see a timeline of events in Armenia involving COVID-19. It shows the timeline of events that took place and how it affected the average number of new cases over a 7-day period over many months. The highest 7-day average took place between the weeks of October 25th and October 31st. This huge spike was due to the Nagorno-Karabakh War.
China has an authoritarian government with the highest population in the world of 1.4 billion people with 397 people per mile square. COVID-19 being a socially transmissible disease highly depends on the social distancing practices followed by the population of the country. China, having a high population, had a higher probability of socially transmitting the disease to other individuals. China was also the first country to be affected by the virus, leaving it unprepared for the measures required to curb the spread of the virus. Even with all the factors against it, China ended with a substantially better response compared to the other countries, with only 95,000 cases and less than 5,000 deaths. China was able to flatten the curve by March 2020, when most countries were beginning their response to the virus. This response was possible because of some stringent steps taken by the Chinese government, which included placing Wuhan, the epicenter of virus, under 76 days of strict lockdown, setting up health checkpoints around the city, effective contact tracing, extensive testing, mask mandate, and large public spaces quickly converted into isolation spaces. This is a timeline of events happening in China during the early days of the coronavirus. Here you can see that on 25th January 2020, hospital construction had started, and by 2nd February, the construction was completed, which is only 1 week after it started. This shows how China took the virus seriously and combated it. WHO Director General Tedros Adhanom even praised China's response to the virus.
South Korea had a fast as well as effective COVID-19 response with characteristics primarily focusing on tracking the individuals within the country that could potentially spread the virus, as well as testing the citizens of the country at a regular and widespread basis. Examples of this response effort can be seen within the diagram here. On January 20th, you could see that the first COVID case was found within South Korea, and they immediately changed their national crisis level to a level 3. This other response efforts can be seen on February 23rd, such as when the government bought 80% of the mask supply in order to ration it out to the public, as well as started testing widespread throughout the country. Other efforts when it came to monitoring can be seen with the pharmacies in the country, where they allowed pharmacies to monitor their patients' traveling records throughout the country, and any person traveling within the country or someone going into the country itself were required to actually download monitoring apps to make sure that if they had COVID-19, the government would know where they are and could keep track of them, as well as certain areas such as bars or different recreational areas requiring individuals to scan their IDs using QR codes in order to make sure that there's a super spreader event, the government would know exactly who was there at the event itself. Overall, this response received a high score of 82 by the Lowy Institute. It was seen as very effective with 31 COVID deaths per million currently and about 7 daily confirmed deaths. The prior conditions that South Korea had before the actual COVID-19 pandemic was that it was a democratic country, as well as having a population of 51 million people. The population density was very high with 515 square kilometers of people in a particular area. The country itself didn't need to rely on travel. With these conditions, South Korea still didn't choose to close its borders whatsoever. Nevertheless, because of the high population, it's possible that South Korea chose to focus on trying to monitor and see how many people were there instead of closing it off altogether, since that might have been not manageable. South Korea also had high public support for its disaster efforts, even with the high amount of monitoring that it saw, possibly due to the past viruses that were in South Korea, such as SARS and MERS prior to COVID-19. We would like to expand our research efforts to more countries in different areas and with different governmental and prior conditions, such as Norway, Taiwan, Jamaica, so on and so forth. And the overall goal that we have for our research efforts is to make sure that we can tailor particular disaster responses for different prior conditions that a country might be into, so that we can make sure that each country has an effective response. Thank you for listening.